Governor Charlie Baker is making an announcement about the site of the former Boston State Hospital. He is also giving an update on the coronavirus. Let's listen in.
We're here on the site of the former Boston State Hospital. The overall redevelopment of this site has been going on. It goes back to when I was serving as Secretary of Administration and Finance in the Weldon Cellucci administration back in the 90s. And one of the most important decisions that was made back then was a decision that was made by the Citizens Advisory Council and by the Commonwealth to stop thinking about the Boston State Hospital site as a single parcel and to actually start thinking about it as a collection of opportunities that could be used to support and service and provide opportunity for the community on a one basis. And it was that decision in many respects that I think unlocked the fact that the whole parcel had basically sat vacant for a very long period of time and suddenly began the process of being redeveloped. And as we're here today, we're talking about the last big development parcel left on the site. And the last time I was around this big parcel was to make the announcement associated with about a $60 million investment in home ownership programming, which the folks at Mass Housing have currently worked on developing an advisory board for, and will probably be putting proposals out to bid sometime later this year, which is going to be a big opportunity for folks in this community, but also folks in many gateway communities around the Commonwealth. Today we're here to announce the selection of a developer for this final site on the Boston State Hospital site, and it will be developed by several minority-owned businesses, which will create important opportunities for them and for people in this community along the way. But before I get into the details around that, I do want to do my daily update on COVID-19 testing cases and hospitalizations. We're encouraged by the continued progress we've made on COVID-19 with respect to our public health metrics, which allowed us to launch Step 2 of Phase 2 of our reopening process yesterday. We'll continue to monitor those key public health data as we move forward toward the next phase. I think, as everybody knows, Phase 2 started recently, and many new types of businesses started operating as a result. I know it's been difficult, to say the least, for all of those businesses and many of their employees, but thanks to everybody doing their part to slow the spread, many more people are getting back to work this week. Our public health team will collect data over the course of the next 2 weeks and monitor how things are going with respect to those key indices as more and more people get back out and about in their communities, and that will inform decisions we make going forward with respect to additional advancements. Now, as of yesterday, 937 people were hospitalized with COVID-19 in the Commonwealth, which is a 74% drop since April 15th. And 180 COVID-19 cases are currently in the ICUs in Massachusetts. That's also a very significant drop from the middle of April. Yesterday, over 6,700 new tests were reported from across the Commonwealth. 149 new positive COVID-19 tests were confirmed, which means the 7-day average for the positive test rate with regard to cases is down to about 1.9%. And that's a 93% drop since April 15th. Last week, as many people know, the Commonwealth offered COVID-19 viral testing for people who recently attended a large gathering, like the demonstrations and protests to honor George Floyd. And this morning, we got the final results of that. Out of 17,617 tests that were conducted statewide, 2.5% came back positive for COVID-19, which is reasonably consistent with the statewide numbers that we see in our daily testing. We're obviously pleased to see that the percentage of positive tests was quite low, considering the frequency and the size of those protests and demonstrations. But we also pointed out that the vast majority of the folks who participated in those demonstrations were wearing masks or face coverings of one kind or another. Many cases they were moving, which I think made a big difference, and of course they all took place outside, which we all agree is a far safer environment than indoors. We're obviously encouraged by the continued progress we've made on many of those public health metrics and are going to continue to monitor them as we proceed through the rest of the reopening process. We do believe part of the reason we've been successful so far with our reopening strategy is due to the work and the efforts of everybody here in the Commonwealth to do the things that make a difference to contain the spread of the virus. Please continue to wear face coverings, practice social distancing and good hygiene, stay home if you're not feeling well, and seek guidance from your medical provider, either using telehealth services, which people here in Massachusetts have adopted enthusiastically, or by visiting them. Most of our healthcare providers at this point are now open and back in business. Keep in mind that COVID-19 will not take a summer vacation. Other states are seeing surges right now. It's a clear indication about how important it is for people to continue to be vigilant, and we want to avoid anything like that happening here in Massachusetts.